Ms. Shipley, you're recognized. Speak into the microphone a little closer.
I'll try to talk quickly too. I understand we're under a little time crunch here, so I'll go through our statements as quickly as possible. David Buchanan, our Vice President of Compliance, is handing out a packet for you. Once we finish our talk here in a few minutes, I can go through the packet with you and let you know what we're going to leave you today. Good afternoon, Chairman Vito, Vice Chairman Johnson, and committee members and fellow guests. My name is Pam Shipley, and I'm the President and CEO of Magnolia Health Plan right here in Jackson. I'm truly honored and appreciative to have the opportunity to speak with you today. Magnolia offers our members all of the current Medicaid benefits and so much more. My goal here today is to share with you what Magnolia can offer above and beyond what Medicaid can do today. We have been on the ground here in Mississippi in building partnerships with Medicaid, physicians, hospitals, community health centers, rural health centers, pharmacies, and advocates to understand the needs of Mississippi members and help people live healthier lives as much as possible. Magnolia is honored to be serving over 33,000 of Mississippi's most vulnerable and medically needy citizens, including the age-blind and disabled, foster care children, and women who are diagnosed with breast and cervical cancer. Our members have multiple chronic conditions. They include renal failure, sickle cell, diabetes, cancer, and congestive heart failure. We believe our members with these complex conditions are best served through a local approach. Through this approach and our boots-on-the-ground mentality, we have integrated care teams that are clinical and non-clinical staff located in Tupelo, Hattiesburg, on the coast, Yazoo City, Clarksdale, and Meridian. Magnolia is staffed with 94 dedicated and passionate employees. They include our call center representatives, provider relations, community advocates, and our medical team made up of nurse case managers, our medical directors, our pharmacists, social workers, and quality staff. We have hired staff that live where they work, and they care for their member as a neighbor because that's who they are. This approach will help us identify and assist in breaking down the barriers that have existed in the past. Let me share an example of just that. Magnolia has a member who's an older gentleman, multiple chronic illnesses, and has a behavioral health issue as well. He remained at home with his 2 adult sons as his primary caretakers. They drove him to his doctor appointments, took care of his home, prepared his meals, and laid out his daily medications. Earlier this year, one of his sons was killed in a car accident on the way to work. His other son, distraught from the death of his brother and the burden of taking care of his father, committed suicide in the front yard. Our member was left with no one to care for him, no immediate family to step in, and lack of trust for a new caregiver. His Magnolia case manager had already been out to see him a few times and had developed a relationship. Magnolia arranged for the necessary services to provide transportation, prepare meals, take care of his home until a suitable caretaker could be arranged. Our case manager today continues to provide follow-up with this member and provide care coordination. This enhanced level of service is now available under MississippiCan. Magnolia is working with each member to encourage a strong and lasting relationship between the physician and the patient as we promote the medical home. How do we promote the medical home? We offer unlimited visits to providers beyond the 12-visit limitation with Medicaid. This enhances the primary care visits and reduces emergency room visits. We focus on preventive screenings like immunizations and enrollment in disease management. We help our members better manage their chronic illnesses. Since we started in January, we have made welcome calls to every member. The purpose of these calls is to educate the members to complete a health risk assessment and to identify any clinical and social needs. We are also facilitating the scheduling of primary care visits for the member. During a welcome call recently, we had a member share with us that she had been without glasses for over 4 years. We were able to solve this. Our representative was able to share with her Magnolia's increased eye care benefit. Every member is entitled to eyeglasses annually and an annual eye We assisted with setting up the appointment, and she now has a new pair of glasses. It is our mission to focus on innovative programs that will improve the quality of outcome for each member. Magnolia launched its Member Connection Plus initiative, where eligible members are provided a cell phone so that they may have a safe and reliable way to contact their providers and their case manager. We have pre-programmed their appointments, their provider phone numbers, and their case managers. We can deliver healthy prevention tips through their text messaging. Recently, one of our Member Connection representatives was visiting one of the members' homes delivering the cell phone. This member had congestive heart failure. In the home, she noticed both the member and the family members were smoking. She was able to talk about our smoking cessation program and provide information to enroll. This member is now enrolled in the smoking cessation program and is setting an example for her family. Additional programs like this are available now through Magnolia and the MississippiCan program. We've increased the monthly allotted prescriptions to 6 unless clinic guidelines call for more. And this limit does not apply to hemophiliac, HIV, chemotherapy, or diabetic supplies. Our sickest and our most vulnerable members are in the Delta region. In the next few months, Magnolia is rolling out Delta Reach, a new initiative where we will hire and train prior Medicaid recipients. They will become advocates of and educators on preventive care and healthier lifestyles across the Delta region. They will meet with their neighbors and community to improve compliance, increase awareness, and break the cycle. They will become role models for their friends, families, and community. We are privileged to have over 58 hospitals, over 2,500 provider locations, and every single community health center in the state. Magnolia works with the hospitals to assist with discharge planning and identification of social barriers. We've been working to educate the provider and beneficiary community about MississippiCan and the benefits to its members. We have participated with Medicaid on the provider workshops across the state. Our provider relations team has provided on-the-ground, in-person training. And in the last week in March, we will provide targeted, focused workshops in a number of regions across the state for durable medical equipment, therapies, and home health providers. We will not stop with simply coordinating the care of these Mississippi residents, but more so, we'll focus on the advancements in care and knocking down social barriers, thus ensuring their access to care and improvements to their lives. Let me share another example. We have a member on the coast who is diagnosed with chronic obstructive pulmonary disease. Our case manager was visiting her on a routine visit. While she was in the apartment, she was barely able to breathe in the mold-infested apartment. Our case manager was able to work with local social services, our social worker, and move the member to a mold-free apartment. Today, she is able to take care of her illness without the complications created by the mold. We move forward with our goals and expectations, knowing that we are all but a blessing away from being Medicaid recipients ourselves. This truth drives us and it inspires us to provide the most dignified and expedited care to our members. Thank you for your attention, and I trust we will have many more opportunities such as today to help in strengthening and resolve to provide the best quality of life for our members. Before closing, I'd just like to share with you that we distributed a packet. Inside the packet you'll find our provider directory, which was distributed on January 1st, along with a supplement for all the providers that have since contracted. There's also a benefit sheet in there. Many of you have asked about benefits that we have. And lastly, and most importantly, there's a contact sheet in there with phone numbers from our executive team. My personal contact phone number and information is at the top. I would encourage each and every one of you, if you hear of an issue, a concern, to please reach out to me right away. Thank you, Chairman.
Thank you, Ms. Shipley. I have a question before we go to other questions. In a situation where we've heard several times about the need for efficiency and reducing duplication, and you mentioned the coordinators and the caregiver workers that the different plans have. In a situation where a person is needing to go to a doctor, and perhaps you have had communication with the beneficiary. Does the caregiver or the person that you have working for you ever actually personally intervene with the doctor's office to explain to the medical staff the conditions that the person is experiencing because when a person goes to the doctor, they see them for 5 minutes and they forget to tell them half of the things that they were thinking about before they go in there. Can you talk about how that might work?
Thank you for the question, Chairman. That's an excellent question. So let me just share a couple of ways that we do that. First and foremost, our case managers, our social workers, our integrated care teams that we've spoken about many times are not in replacement of the physician. It is our desire to make sure that every member is getting all of the healthy preventive screenings, all the care they need through their physician. They're support of that. They're there to educate, they're there to help that. We 100% reach out to the physician, make sure that they're aware of multiple chronic illnesses if that's what they need to know. Make sure they're aware that we're available to help with the education of that. We're there to help with specialist referral appointments, that sort of thing. In addition to that, our clinical integrated teams that we spoke about before are located across the state in many regions. They will be actually physically in provider offices very soon. We are actively working with a number of offices across the state where they will be physically residing within the provider office. What that allows is if a physician sees one of our members, diabetic member, understands that they need to see a podiatrist, there's other needs for that member, we have somebody who is right there that can help coordinate the care.
Okay, at this time the gentleman from Adams has a question, and then I think was the gentleman from Marshall, did you have a question next? Okay.
Thank you, Ms. Shipley. Your company, are you all providing this service in any other states? And if so, how many other states and what's the population of patients you're serving nationally?
Thank you, Vice Chairman. Appreciate the question. So Magnolia, as everybody knows, is a local health plan. Our parent company, Centenne Corporation, operates in 11 other states. I encourage you to go to our website. You can see some additional information there. We serve over 1.5 million Medicaid recipients across the state. We serve SSI, ABD, foster care program, TANF, CHIP. We talked about many of the other programs.
Okay. And my other question is, under the limited care program, I don't want anybody, you all are not, this is not the ideal situation, but it works into the formula of your business plan in terms of the way you do business. Well, my question is, ideally you'd like to serve a larger population, is that correct?
Thank you, Vice Chairman. We would definitely like to expand the program.
Okay, thank you.
Thank you, Mr. Chairman. First of all, let me just say that we're impressed with the outlay that you gave as it relates to the different examples of how you all have really stepped in and assisted patients with not just treatment, but with the care, the total accountable care approach. And I do like that. And that is impressive. I guess the only question I have really for you, because other questions were already directed toward the other organization that does pretty much what you all do, is that at the end of the day, the concern we might have is that people who are eligible for services, who need services, receive them. That's at the end of the day, that's our concern. And so with that in mind, anything that prevents them from achieving this or getting these kinds of services, things that are, for instance, if a provider has problems with an organization because they have too much paperwork to do, or now rather than dealing with just the Medicaid office, now you have to deal with United and Magnolia and Medicaid and Medicare, this adds extra responsibility on these providers. Anytime you run into that problem, providers tend to say, well, this is just too much work to even try to deal with this. We can do this through some other, it's just too much trouble to deal with all these different organizations. So the question becomes twofold. Is your reimbursement, I think this question was alluded to earlier, is your reimbursement process similar to or pretty close in terms of of the time frame when you reimburse a provider? Is it about the same as it is with Medicaid? Do you feel like there's your paperwork or the extra load of trying to be enrolled is too cumbersome and it causes problems? Do you find providers having problems with that?
Thank you, sir, for great questions. So let me answer the first question. So the first question is our payment. I believe either Ms. Williams or Ms. Gallagher answered already, but just to reconfirm, our payment is no less than Medicaid today. So providers are reimbursed exactly as they're reimbursed, no less than Medicaid today. To answer your second question, which is a great question, is it is our desire to not increase paperwork, to not increase administrative burden for the physicians, for the hospitals, for the pharmacists, for the therapists. And we are working very hard, as many of you know, meeting with the association, meeting with as many providers as we can to best understand how we can streamline that, how we can help them and assist them in understanding that they are now working with Magnolia, United, and Medicaid, and how we can best streamline that for them. It is absolutely our desire to continue to do that, and we welcome their feedback to do it better.
Thank you, Ms. Shipley. Does that conclude your presentation?
It does. Thank you, Chairman.
Thank you. And I noticed that you had some